Case-West syndrome, infantile spasm, GDD. Every parent must know the entire journey of this child, from starting allopathic treatment in Canada to returning to India and then continuing allopathic treatment in India. What was the experience of this child's parents and what they faced? We are not cutting this video anywhere so that you can get complete information.
Tell us a little bit about, obviously, the first pregnancy. We always anticipate and we dream and we have a lot of hopes that we have a safe and healthy baby. That is always the first thought that comes into every first parent, and the second baby, and the third. So when you had Mir, what were the vital signs that you saw that you made you feel your intuitions were that there was something which is not right?
So initially he started with the kind of seizures, and on the first day it was just one episode of a seizure. Okay.
What were the seizures like?
So basically he was just lifting his left leg, kind
Okay.
of spasms.
Okay.
Okay.
So it was infantile spasms.
Yeah,
like-
kind of that
okay.
thing. Okay. So it was only one.
Huh.
Matlab, बहुत abruptly he was just doing it. Okay.
Right.
And on the second day the number increased to 3.
Okay.
And that's when I spoke to somebody and they said it's normal and babies tend to do things like
Was it a member of hospital or was it?
it was
personal?
my actually friend who
Okay.
was acquainted with sort of medical knowledge kind of a thing.
Okay.
But on the third day, that's when the number of seizures have increased from 3 to 8.
3 to 8. Okay.
That's when my friend is a gynecologist again.
Okay.
So basically I'm a dietitian by profession.
Right.
So I used to plan a diet chart for the gynecologist. So we
Right.
were on like kind of friendly terms.
Yes.
So I just sent her a video of him having those spasms.
Right.
So as I've told you, the number has increased from 3 to 8. So the intensity has increased. So when I sent her this video, right, she told me those are fits.
Okay.
Okay. And I asked her, is there something to be worried about? She said yes. And then immediately I rushed to emergency. Okay. And then so during that time I was in Canada. So we had to just go there. And then they took his EEG and they told us that they are seizures.
So sorry to interrupt you there. It is because you said you had to rush to emergency. Were you at the hospital itself or did you
No.
bring him home and then you saw these kind
No,
of?
he was 1 month old.
Oh,
was
he's
already at
1
home.
month old. Okay.
He was-
But at birth you didn't see
No,
anything.
nothing. He was absolutely normal.
What? But was he lactating? Did he suck? Did he?
Everything was fine. He was
Everything
laughing. He
was
was
fine.
playing. Yes.
Okay. Okay.
So everything was fine.
So you took him home. Everything
Yes.
was fine. Nothing to
No,
worry about.
Nothing. Yeah.
And then in a 1 month's time, that's when
That's
you
when I
started
went.
noticing.
Yeah. So we went there and they diagnosed him with seizures.
Right.
Okay. And then he was started on some a medicine, and everything was under control. He was hospitalized for 4 days, and then after that he was perfectly fine. So after 15 days, that's when I started. So he started crunching a bit forward. Okay.
Okay.
And because I was petrified of the seizures, I was strictly warned not to do any sort of Google research.
Right.
Because as most of the tech savvy people, right, I'm used to browsing like from headache to tumors. So they told me,
It automatically comes as tumors.
yes.
Yes. Yes.
So I stopped doing that. But
Yeah.
suddenly what happened? I don't know. One fine day I just sneaked and I was just looking for seizures because honestly I didn't wanted a baby of 1 month to be started on all these
Medication.
anti-epileptic drugs and stuff.
Yeah.
So then that's when I stumbled upon a video wherein baby was doing the exact same movement as my baby, when he was crunching his body a bit forward. That's when I again called the doctor. I said he's having this crunching kind of spasms.
Right.
So like, how do I go about? So he told me to come the next day, and then again his EEG was taken.
This was in Canada.
Yeah, everything was in Canada. Okay.
Okay.
And then they told us that then they diagnosed because see, initially when the EEG was done during his seizures, they said there's some sort of abnormal activity going on behind, like besides seizures, right?
Yes.
There's some irritants or something that's happening in the background. So this time they have a proper diagnosis that it's infantile spasms along with seizures. So then they started him on like a medicine which again I didn't approve of. It was much scarier than the previous medicine. Although
Right.
I was reluctant, but his spasms, right, they kept on increasing. They were like, he used to cry, and like he was a different child now. Initially I didn't wanted to start on that, but because we were desperate, we thought maybe it's gonna help. So for 2 weeks I put him on that medicine. There was no difference. And then like almost 1 month passed by, and that's when his spasms, right, they started reducing. Like बोलते हैं ना कि बहुत थोड़ा थोड़ा सा difference आना चालू हुआ. But still I was not happy with the kind of response that he was giving. And I was told that not every child is going to have the same kind of response, and the spasms, right, they are very resistant. And if at all not that medicine, maybe he might be put on steroids. And definitely for a baby who is like 2 months old, I didn't wanted him to be put on steroids. And unfortunately unfortunately over there's a long waiting period. So his spasms were increasing, seizures were also increasing. Okay. And now, because see, the thing with seizure medicine is, like once he starts gaining weight, the
They
dosage
increase the
also has to
dosage.
increase. Okay. So his health was going crazy. Okay. He started talking, I mean, blabbering, laughing, everything when he was 2 months.
Okay.
And that baby is now changing.
Hmm.
Okay. People have told that at 2 months, right,
Hmm.
they'll hardly do anything, but he was blabbering.
Right.
He was just doing ow and all those
Hmm.
cute things that
Hmm.
babies usually do at 3 months.
Right.
Okay. He started doing it too early.
Hmm.
So all those stopped, and then unfortunately what happened, as I've told you, his seizures started increasing, spasms started increasing,
Right.
and the medicines were not working for him. So unfortunately over there, right, we had a long waiting time. When I told them that yeah, his situation is not getting better. He was working, and for me, I was staying at home for almost 24 hours
Right.
with him, alone with him for almost 12 to 14 hours.
Yeah, that can be scary.
It was scary. Okay. And plus no knowledge about it.
Yes.
And when you browse about it, the only thing that people say, or the Google says, is that it's a resistant one, and it could lead to a lot of developmental delays, some delays which might be permanent.
Right. So seizures that we're mostly talking about is the West syndrome.
Yes, person, yeah. So so then I rushed by ticket to India, because over there I had to wait for 12 days to just speak to the doctor over call.
Right.
Where he told me just to increase the dosage of whatever medicine that he has been taking.
Okay.
Okay. So then I rushed to India and I came, and so I'm gonna, without taking names, I'm just gonna briefly tell you my experience. So the doctor that I went to initially, he changed his medicine entirely. And because he was not vaccinated when he was born there, because over there they are not this thing scared of all these tuberculosis and all these issues, right? They don't get the babies vaccinated with BCG. So he was not vaccinated with BCG. So immediately they vaccinated him with BCG, and they changed his entire medicine, this thing, whatever he has been
So
following.
he got his first vaccination in India once
Yes,
he
India,
came
when
back.
when he was almost three months,
Yeah.
I guess.
Trust Indian doctors to
Yeah.
always, believe in medicated children.
Yeah. So I think that didn't work in his favor.
Yeah.
So the medicine and the vaccine, right?
So what happened to him?
So when I
Worsen.
Worsen.
Yeah.
So give an example, like what happened, because a lot of parents go through the same thing when their child gets vaccinated for the first time. I have many cases where the West syndrome started after 3 months or 4 months of after coming from the hospital. So like your case, you didn't see anything until the 1 month that had gone by. So there are also parents who have given vaccination, and then after a certain time of coming out of the hospital, being discharged, all the activities are there, and then suddenly it stops, and suddenly they see a seizure. So what were your symptoms after you saw that his medication was changed and he was vaccinated for the first time?
So the thing with his medication, when they were changed, I just saw there was an increase in seizures. Okay. But with the vaccine, right? Somehow I partly blame the vaccine also. Maybe that was too much of lead. I don't know what's the reason, honestly. Okay. Then after we gave him the vaccine, after 2 days, he stopped laughing.
Okay.
For 1 month, he didn't laugh.
Okay.
for almost 2 weeks he was just lying there without going.
So no reaction.
No,
No
nothing.
reaction, no nothing.
Nothing.
Okay.
He hardly.
And what about the body? Was the body more limpy and
Nothing as such. Body में ज़्यादा difference नहीं था.
okay?
But then I mean, he was just, I would say, vegetative is the
Okay.
term. Okay.
Yes.
Wherein he was not moving, he was just looking.
His eyes were
His eyes,
wandering.
yeah.
Yes.
Initially, he was laughing and he was
Right.
actually looking at us.
Right.
As I've told you, right, when he was 2 months, he was a very happy and a very cheerful baby.
Yes. He
He used
showed
to
me the
look at
video.
me. Yeah,
Yes.
he used to look at me. He used to laugh. He used to laugh
Yeah.
a lot, and he used to respond to me when he was 2 months old.
Right.
Okay, I don't know. After vaccination, everything changed. I
Okay.
personally felt. Okay?
So that is when you came to India.
Yeah,
and you took
that's
that.
when I came to India.
Okay.
Okay, and so after that, right, things took a very. I mean, I don't know. We then changed our doctor, and then the moment we went to the doctor, he asked us like, so which medicine was he put on and everything, and he changed the entire prescription, and that's when things started to fall into place. Okay, he was not better. Not too great, I would say, as he
But
was
stabilized
before,
more.
but a little stabilized.
Okay.
Okay, so that's what was the journey since then.
Right.
So you see, even after undergoing such a long allopathic treatment, did they really get any meaningful results?
How did you find out about Nadi Yoga and me?
So as I've told you, research savvy. तो मैंने काश, I would say, काश मैं थोड़ा पहले जान लेती, because when I was there, I was so desperate because there's hardly any information available about
Yes.
this thing,
West
infantile.
syndrome and stuff. Yeah.
So see, the reason is मैं इतनी desperate थी, I was, because none of my friends, kids, nobody, मतलब you are, मतलब मैं, I told you, right, I was alone with the child for 12 to 14 hours. तो
Yes.
for exactly 12 to 14 hours, उसमें से almost शायद मैं 8 घंटे, because he used to sleep most of the time, 8 घंटे मैं सिर्फ browsing में time निकालती थी.
Right.
That like उसका treatment क्या है and all those things. Okay. Even when I came here, right, मैंने बहुत ढूंढा alternative therapy and all that, because I was not happy with the kind of side effects that all the medicines are carrying.
Right.
Because see, I would like to tell people that allopathy doesn't, so again, no offense, but then allopathy doesn't treat a disease without creating 10 more. Okay.
Yes.
So so as I've told that I was doing my research and all, so I stumbled upon one video. उसमें था कि वो बच्चे को जो भी मेरे बच्चे में सिम्टम्स थे, वो सारे सिम्टम्स थे. मैंने मेरे हस्बैंड को बोला, अरे ये तो गजब हो गया कि पहली बार मैंने किसी बच्चे को सेम सिम्टम्स देखा. अदर एंड दे सेड, मतलब neck holding and all that, we hardly,
it's kind of unique. Everyone is either having infantile spasm or epilepsy,
but symptoms अलग है.
vast variety of it. So कोई ऐसे करता है, कोई ऐसे करता है, so people, it's one of the subjects in science where hardly parents get into.
Yes.
Now, let's see the results. What was the result of Dr. Nishi's brain programming session?
अच्छा बताओ, क्या आपका कल आए हैं आप? कल जो है आपने टेस्ट करवाया and whatever, and then you brought in your the old kind of the test that you have done so far here.
This one.
Yes. So ये आपने करवाया था ना?
Yeah.
Yes. So if you don't mind, I'll just
Sure, no problem.
ये आपने कब करवाया था? In February, just in February this year, 2024. Okay, and you can check what it says. This is the West syndrome. The other name is the West syndrome of that. ठीक है, जो अभी आपने जब करवाया है वृंदा का, जहाँ पे आपने कल टेस्ट करवाया, and thank you. So this is a severe form of seizures, and it is a mixture of seizures and infantile spasms. Okay, तो उसको West syndrome कहते हैं. तो उसमें से एक ही सेशन हुआ है अभी, राइट? और एक सेशन के अंदर क्या आया है? जनरलाइज्ड आ गया है.
Just one session and West syndrome transformed into just generalized epileptiform discharges. This is what the result of Dr. Nishi's brain programming session shows in the EEG report.
दूसरा आपने क्या ऑब्जर्व किया, ये बताओ.
हाँ, वन थिंग,
उसका
उसका फेस और उसका एक्चुअली हेड ना, उसका बॉडी से थोड़ा बड़ा था, एंड ओवर हियर, राइट, इसका थोड़ा सा स्वेलिंग था, मतलब
बम्प था,
बम्प था. मैंने एक डॉक्टर को भी दिखाया था.
हाँ.
अगेन नो ऑफेंस, ओके. मैंने डॉक्टर को जूम इन करके फोटो दिखाया था इसका, वो आऊ बना रहा था, प्यारा सा, इसको यहाँ पे बम्प था. दे सेड दैट नो, इट्स ओके, इट्स जस्ट स्ट्रक्चरल.
हाँ.
सो अभी ना हमने देखा कल सेशन के बाद उसका ये बम्प जो है वो कम हो
हाँ।
गया है.
Not just visibly,
Or-
we took the measurement before the,
हाँ,
the treatment and
after
after
the
the treatment.
treatment.
And in no time, it has went,
Mm,
his face structure has improved.
और उसका
हाँ,
And
फेस जो भी है
after going home from here, like, he was playing with me.
अच्छा.
It was,
रात भर जगाया था इनको. फिर हाँ, और
Then he
उसका
was happily awake, I'm
Yeah.
sure.
और इसका फेस भी श्रिंक हुआ है.
Shrink हो गया.
फेस और ये
Head
सर जो है,
size,
head size
head
और
size
face
is decreased to what, 1 centimeter,
हाँ
ना?
almost yes
1
हाँ,
centimeter उसका कम हुआ है.
कम हुआ.
Not just in the EEG report, improvements are visible physically as well.
So what have you experienced in Nari Yoga, and what would you like to tell other parents who are still thinking and making up their mind about coming here?
So I would say कि don't delay it, क्योंकि ना क्या कर रहे हैं पता है, बहुत लोग सब जगह पूरे मेडिसिन वगैरह सब करके बच्चे को टॉक्सिसिटी इतना सब देख के फिर डेवलपमेंटल डिले, द टाइम दे आर 4 years 8 years 10 years, दैट्स व्हेन दे आर कमिंग फॉर ऑल्टरनेटिव थेरेपी और नाड़ी योगा. तो इतना डिले मत करिएगा. और आप बिकॉज योर बेबी, बिकॉज उसका तो कोई अपना ब्रेन है नहीं. ओके, सो ही इज कम्प्लीटली रिलाइंग ऑन यू. ओके, तो आपकी जिम्मेदारी बनती है दैट यू टेक द राइट डिसीजन एट द राइट टाइम.
And as a father, आप क्या कहना चाहेंगे?
Well, initially I was, I wasn't sure. We did a little bit of research. Any other parent could be, thinking, yeah, what is it all about? No worries. Just call them. They're just a call away. Or if you could visit, if you are close by, just pay a visit, have a word with the doctor. And we were very much satisfied even before coming. And we thought we'll definitely go ahead because the amount of poisonous medicine medication he was on to, we thought there is no harm in trying some alternative medication, and it had miraculously turned out to be very good, treatment, I'd say. So, who are parents who are into, who are encountering this kind of illness in their kids, that's where Dr. Nishi deals with. Please come, have a visit, and definitely you'll be having a tremendous and a positive, energy you'll be going out with.
For more information or to book an appointment with Dr. Nishi, call today 70608 19333 or email us your details at drnishibhatt@gmail.com. All the clips shown in this video were from the live video. If you want to see the full live video, then you can watch it from the link given in the description.